I'm Dawn Ayres, I'm the acting team leader from the Early Intervention in Psychosis Service, and this is my colleague.
My name's Tom, I'm an occupational therapist within the service.
We've been here today for the Mental Health Festival, and I thought I'd start off by saying I had a group of schoolgirls come to our stall and kind of ask me, what is kind of psychosis? And I kind of took them through kind of our leaflet that we got here, that really it's kind of a collection of things that you would notice about someone. So no one person is the same. And here's some examples on here. So it could be, people's sleep is affected. They might be experiencing things like hearing voices, feeling afraid, not being able to go to school or to work. The whole kind of collection of things that you will notice and realise there's something not right for this young person. And I say young person because our team works with 14 to 35-year-olds, and that is because that is the highest incidence kind of age range. And it's really important that we do get support in early, because if you do, then prognosis is really, really good. People make a full recovery. They can get back into their education and getting on with their lives. And our team is very much about working collaboratively with that young person and their family. We do a range of things, and I'm going to ask Tom just to talk a little bit about what our team provides on a day-to-day basis.
Okay, so within the Early Intervention Service there's a big focus on the word recovery, and our team is made up of many different health professionals. It can be care coordinators, occupational therapists. We've also got STR workers and peer support workers, as well as many others. Some of the main things our service does do, every client who comes into our service is allocated a care coordinator, and that care coordinator will be there overshadowing all of the care happening for that client. So an example of some of the roles that might be in their role would be things such as medication reviews, organising discharge planning for when that's due, attending CPA meetings. And within the supporting staff of the service, we can help from anything with employment, education, leisure activities, benefits, housing, lifestyle, recovery, and there's a lot of family support, as Dawn obviously said, and just general well-being really of the client. We also work with a lot of sort of outside organisations as well to help promote our service. We've recently linked up with the Hearing Voices Network to provide groups for voice hearers. We also have a Charlton athletic programme, and then there's a big push for that at the moment.
We try and make it as individual as we can for that person, so we try and link them in with what they need, and everyone is unique in that respect. A big part of what we do as well is actually supporting carers. So we run carers workshops on a Saturday so that carers can get information, can get a welcome to the service, and can talk with other carers about their experiences. And that's the biggest feedback I get from carers, the thing they value from their events, and they say, thank you for the bits we've put on, but the most important thing for them is networking with other carers who have had similar experiences, and that comes across really strongly to me in those kinds of venues. Also what we do is provide information to carers, so as soon as they come into the service we try and make sure that they have information about support and information on psychosis.
I think what's also unique about our service is that clients can be seen for up to 3 years, and as a practitioner that's brilliant, because there is actually time there to really try and build that rapport, and sometimes things can take a couple of steps back, but there's time to actually try and look at different strategies to help someone in their recovery. And I think everyone who works within our service was very privileged to be in that position where there is actually a chance to really build that rapport with a client, and I think we're quite lucky to be in a service that can allow us to do that.
Yeah, I think that shows today with staff, supporting this event and coming along because they want to tell people, about our service and what we do. And that's something that we're hoping to strengthen as well. What's come out of today for me, we're talking to carers, is about information in GP surgeries, whereas we have done leaflet drops and provided information in the past, that seems to be lacking now. So we're going to kind of look at that and get out and make sure that that's available so people know how to find us, because anyone can refer to us. We try and make it as open as possible so that people can have support as soon as possible. Our message is make sure you get a referral to our service, and from then onwards we will try and help you feel less frightened about that, sort of give you education and advice about how to manage things. Certainly one of the workshops we do with our carers is managing difficult or unusual behaviours. So it is working and not feeling alone. And I think a big thing of what our team, and I'm sure Tom will agree with this, is about holding on to hope, that although things are difficult at the moment, it will get better. And we've been really fortunate today. We've had a couple of individuals that use our service be here with us, and they've been able to talk to carers about their experiences and their recovery, really. And that's something, again, carers are asking for, and something we hope we're going to include is, some of those young people coming along and telling their story, really. Because I think that does give carers hope that, yes, these people were in very similar situations, but now, they're out doing things, they're recovering, and some of them are now leaving our service and have moved on to their own accommodation, just wonderful things. So I think that would be it, make sure you get the support that you need, and, we're more than willing, to talk to people if they fear that could be something that's being experienced, because it is often that unknown, what's happening, and not being able to make sense of it. And then with our kind of support, it can make sense of it, really, and kind of a path together, really.
Anyone can refer someone to our team, whether that be GP, parent, self-referral, school, counselling service. If there's any indication there that you believe that someone might be experiencing the start of some psychotic phenomena, we're always there willing to obviously talk to whoever that referrer may be and offer advice and obviously guide what our team can provide if that person is deemed to be suitable for the service.